During the early years of clinical psychology, the field was heavily influenced by psychoanalytic theory, developed by Sigmund Freud. Freud's emphasis on the unconscious mind and childhood experiences shaped the way mental illness was conceptualized and treated. Key figures in the early history of clinical psychology include Leitner Whitmer, who is often credited with establishing the first psychological clinic in the United States in 1896. Whitmer's work focused on applying psychological principles to the assessment and treatment of individuals with learning and behavioral difficulties. The rise of psychoanalytic theory, with its focus on exploring the unconscious roots of mental illness, had a significant impact on the development of clinical psychology. Freud's ideas sparked interest in the inner workings of the mind and led to the development of psychotherapy as a treatment modality. Formation of clinical psychology as a discipline. The early 20th century saw the formalization of clinical psychology as a distinct discipline within the broader field of psychology. Professional organizations such as the American Psychological Association were established to promote the growth and standardization of psychological practice. Professional organizations and training programs, the APA played a central role in the development of clinical psychology by setting standards for training and accreditation of practitioners. Training programs were established to provide aspiring clinicians with the knowledge and skills needed to practice effectively. Shift towards empirical research and evidence-based practices. In the mid-20th century, there was a notable shift towards empirically supported treatments in clinical psychology. Researchers began conducting controlled studies to evaluate the effectiveness of psychotherapeutic interventions, leading to the emergence of evidence-based practice as a guiding principle. Evolution of treatment methods. Over the years, clinical psychology has witnessed the evolution of various treatment approaches aimed at addressing the diverse needs of individuals with mental health concerns. Behavioral therapy, which focuses on modifying maladaptive behaviors through learning principles, emerged as a prominent treatment approach in the mid-20th century. Techniques such as systematic desensitization and operant conditioning were used to treat phobias, anxiety disorders, and other behavioral problems. Cognitive behavioral therapy (CBT) represents a synthesis of cognitive and behavioral principles and has become one of the most widely practiced forms of psychotherapy. CBT helps individuals identify and change negative thoughts, patterns, and behaviors that contribute to their psychological distress. Humanistic approaches to therapy, such as client-centered therapy developed by Carl Rogers, emphasize the importance of empathy, unconditional positive regard, and genuineness in the therapeutic relationship. These approaches focus on empowering individuals to fulfill their potential and achieve personal growth. Integration of science and practice. One of the defining features of contemporary clinical psychology is the integration of scientific research with clinical practice. This integration ensures that interventions are grounded in empirical evidence and tailored to meet the unique needs of clients. Importance of research in shaping clinical practice. Research plays a crucial role in advancing our understanding of mental health disorders and informing the development of effective interventions. Clinical psychologists engage in both basic and applied research to address pressing questions and improve treatment outcomes. Evidence-based interventions. The emphasis on evidence-based practice has led to the widespread adoption of interventions that have been rigorously tested and shown to be effective. Clinical psychologists are trained to critically evaluate research findings and integrate them into their clinical work to provide the best possible care for their clients.